Nicknamed the home of 1,000 hits, RCA Studio B became famous in the 1960s as the birthplace of the Nashville Sound. As the recording home of music legends such as Elvis Presley, Willie Nelson, and Dolly Parton, the studio played a major role in establishing Nashville as a recording capital. Today, the Nashville Sound is woven throughout the city's cultural, business, and social fabric. It's part of who we are to challenge the status quo, especially when it comes to fair and equal access to healthcare and coverage. For today's duet, we'd like to welcome the host of A Second Opinion podcast, Senator Bill Frist, MD, and Florida Blue President and CEO Pat Geraghty, to break down the social dilemmas dogging progress and ways healthcare payers, providers, and technology players can sing a new tune.
Thanks for joining us this morning. I'm Senator Bill Frist, and I'm here with my very good friend, Pat Geraghty, President and CEO of Guidewell, a $19 billion mutual insurance holding company headquartered, as most people know, in Jacksonville, Florida. Guidewell is the parent to a family of truly forward-thinking companies focused on transforming healthcare, including Florida Blue, the leading health insurance company in Florida. They serve 27 million people across 35 states, including more than 5 million individuals in Florida. Pat, good morning. Good to be with you.
Good morning, Bill. Always good to be with you. It's nice to see you again. Yes, Guidewell really is a family of companies. The one that is sort of the household name is Florida Blue, which is the Blue Cross Blue Shield company here in the state of Florida. But we've now built around that particular asset things like Pop Health, which is based in Nashville, Tennessee, and does chronic care in the home setting. And we've got our Guidewell Health division, which is a number of different holdings that are in the direct delivery of healthcare. And so we've learned a lot of lessons in that space. We're very excited about those ventures. And then another one that people don't really spend a lot of time on or that aware of is our Guidewell Source business. And in that business, we have fully 1/3 of the federal Medicare traditional program where we're the payer. So we've got a lot of different things going on, and it really has opened up the organization and given us lots of different ways to impact the health and healthcare scene.
Pat, the coronavirus pandemic has fairly disrupted our society and our healthcare sector in ways that neither you nor I would have ever imagined. And how have you responded to this challenge and at the same time provided some certainty to your members?
Yeah, Bill, it was a complete game changer, obviously. The first thing we said was we have to get our organization safe and at home so that we can do the best job we can do for our members. So for most of our organization, we got them into a home setting. For those who are in direct delivery of care, we had to get them the PPE that they needed and the protocols for dealing with membership that would be coming in with COVID-19. And so there were a couple of different fronts that we were operating on to make sure that our people were safe and could then do a great job for our members. On the member side, we said, we're going to pay for testing. We're going to pay for care related to COVID-19. We're going to pay for the members portion of the televisits that happened. When this started, we had 1 million of our people covered for televisits through Teledoc, but we opened that up to our entire membership and have had tremendous success in using telehealth through all of this period of time. For our members then that were hitting the economic crisis, we said we bridged them and we allowed them to go a number of months without making any payments. And we paid the claims back through the provider system. As you know, in the ACA, for 30 days, we're on the hook. After that, the provider's on the hook. We didn't think that was right since we were extending the members. So we paid all the claims that showed up, more than $50 million of claims that showed up after the first month of members not paying their premium. We thought it was the right thing to do. And so we extended that kind of coverage to our members. For our small group accounts, we discounted prices virtually right away. And in the ACA, you couldn't change your pricing. But what we did was we bulked up the incentive dollars that our members could get, which allowed them to get much higher incentive payments, which then were able to offset their premiums. So lots of things. In total, it was about $250 million that we unilaterally gave back to members and providers.
Pat, personally, huge hurdles. We didn't know what was coming. We didn't know how fast. We were getting mixed messages from above. But just personally, what was the biggest challenge coming through this? What were the biggest hurdles? Was it the unknown? Was it the uncertainty? Was it the mixed messaging? Was it the public health response that you were adjusting to? What, from a personal standpoint, as a CEO and as a president?
Yeah, I mean, Bill, there were certainly a number of things there that were confusing, but what we decided to do was to insert ourselves any place that we could, to have as much influence as we possibly could, and to make sure that we were dialoguing with all of the various stakeholders. So when we weren't hearing enough strong messaging about mask wearing, I worked with a number of other CEOs, and we got 135 CEOs in the state of Florida to sign on to a pledge to wear masks and encourage the wearing of masks, social distancing, washing of hands, and staying out of crowds. We all signed on to that together. We made that very public in our state. I think it was an important message that we put out there. I worked on a task force that advised the governor on increasing testing. When we started that task force, we were doing about 10,000 tests a day. We upped those to 80,000 tests a day through our task force helping. We didn't do all of that ourselves, but we were a contributor to getting much more testing into the state of Florida. It was absolutely critical that we do that. And so we were trying to get ahead of the problem. Yes, we had mixed messages going on from Washington and other places, but we tried to drive our message as much as we could around how to take care of our members, how to take care of our employees to make sure they could assist our members. And oftentimes we found ourselves a little bit at mixed messages with some of the other public statements that were out there, but we continue to drive our message as a credible source to the people that we cover.
And I want to get back to going a little bit deeper on behavior and behavioral aspects, but I am curious. You've been around a while. We've known each other for a while. You're running a huge organization in 35 states, and as well as the Florida focus. Has this pandemic and the unknown as big a challenge as you've seen personally, as you look back over the last 30, 40, 50 years for you in terms of your own experience?
Yeah, I would say to you, you ask about, for me, I will tell you that, and I'll share with this group. Personally, I managed through this COVID-19 in that, my mom passed away not from COVID-19, but she passed away in April. My dad passed away in June, and my sister passed away in August, all from related to cancer. And it was very difficult, very challenging. I felt personally how much challenge it was to be at distance, to not be able to grieve in the way that you would normally be able to grieve. And it gave me a right up front dose of what people are dealing with. And so the empathy factor, I think, is really critical. When you're in a leadership role, you have to empathize with people who are on the front line of taking this on or are being impacted by it every day. And so we in our organization started an every week message on video from me to the organization. I spoke to every employee every single week, still do through this entire time. And we made it an open forum. It was about their mental health, about their well-being, about challenges they were having operationally, what they were seeing from the membership, and how we collectively could be responsive. And then certainly, as we came through the year, we also factored into that issues of racial equity, and all of the various things that were going on in that space, as well as the economic downturn. So yeah, it's been as challenging, but I think we're well positioned as an organization. Our team came together in a fabulous way, and when you have really strong culture and great team mates, you really find that people rise to the occasion and have done a tremendous job of taking care of each other, taking care of our members. I'm very proud of them.
I think those two issues of empathy, which is kind of a variation. We got a bunch of healthcare leaders in the room with us now, of knowing your stakeholders. And we usually think, know them and in terms of positioning, but what we're really saying is empathy. And I think that communication skills, the consistency, the sincerity, the certainty that a message will be there for you consistent with culture is so important. And obviously y'all doing that tremendously. Let's go a little bit deeper. I mentioned healthy behaviors. One of the things that the pandemic has shown us, we always have known it. We all talked about it and wanted to lead around it, but it's hard to do because we have our own bottom lines. But we've become increasingly aware of the fact that our health outcomes, at the end of the day, how healthy, what's our well-being, are more likely to be determined by where we live, socioeconomic status, education, where we work, our access to and the type of foods that we eat, than it is by me being a heart transplant surgeon or being a doctor or the medical care delivered at a hospital. What are some of the steps that you are taking to make what the Robert Wood Johnson Foundation sort of made fashionable, and I agree to, but is to make the healthy choice, the easy choice by your members?
Yeah, Bill, right away, we established that we don't even refer to ourselves as an insurance company. We refer to ourselves as a health solutions company with a much broader mission than just the insurance piece. It's something we do, but we do a lot of other things. So in this particular space, food security has been a very big issue of ours. And I'm not just talking about donating money or donating funds. Food security is absolutely critical. Let me give you a specific case. COVID-19 hits, and we find out that a lot of local restaurants are being challenged, and therefore they're not buying from the local farms, and the local farms are not working in concert with the food bank. And so all of these players are having some challenges. For us, all of our people were going to be working from home, and therefore our big industrial kitchens were going to sit empty. So we created this cycle where our kitchens started making the meals that went to the food banks, getting the food from the farms, and we've served well over 300,000 now meals to seniors and others in need during this pandemic. But it was putting our resources to work. And it's sort of that kind of culture. That's one example, but it's the culture that we've created here. With food banks across the state, we've replaced their refrigeration so they can have more healthy choices. You find so many people, particularly when you're in the ACA book of business, that are getting their food from food banks. And so we wanted to upgrade what our food banks were serving, and not just by contributing dry goods, but by going in there and changing their ability to serve fresh foods across the state. We also created a competition, and in that competition, we had 52 local players from across our state who competed for an award, and we awarded a local farm to table group who are helping to bring farm product into the inner city. And so that's the kind of innovation we want to spark and encourage. So it's not just what we're doing, but it's how we're engaging the community to light a fire under their hopes and dreams, and make it possible to bring those folks who are trying to help the community front and center.
How much resistance do you see in terms of looking at the non-medical aspects of health and wellness and well-being? At the end of the day, for both Guidewell and the Florida Blues, you've got a responsibility, and you got to make sure what's coming in is going out. And yes, you've got the mission of health and well-being, but aren't there a lot of people who come and say, why in the world are you, spending time on food issues, or I'm not sure if you're doing anything in housing, but these sort of, wastebasket term social determinants of health. What's your response to that?
Yeah, my response is that the things that influence people's health more than health care itself are these social determinants of health, if you will, or drivers of health. We typically use the term here. And I think they have great impact on people's journey in life and whether or not they live a healthy life or not. And so I think the return is longer, but when you have as much of a market share as we have, we think these are great investments in our community, and they have significant payback. And one of the other things we've noticed is it pays back in loyalty. So we've had tremendous retention of our membership because of quality service, because we're doing the right thing in people's communities, and they see that. So we invest in literacy, we invest in transportation and getting people to the services that they need. And we've got lots of complementary services that are more wellness and health related than they are just about health care. And I think that comprehensive package is the way we believe we live our mission, and that it really pays off with the right things for our membership.
It's not why you do it, but again, because of the audience that we have today in terms of healthcare leaders. I think it's a good question for me to ask, and that is, you measure net promoter score like we all do. I think it's important. It kind of comes to what you said before of putting yourself in the shoes of others, or empathy. And do you see this sort of commitment to culture and a more holistic sense of health and well-being than the traditional model? Does it actually get translated into an increased net promoter score?
Well, I'm not sure if I can draw all the lines and all the dots for you on the connectivity, but what I can tell you is we've been actively involved in all of this health and wellness for the last number of years, as you know. And in the last round of net promoter score, we had the highest net promoter score in the healthcare sector. So yeah. I would submit to you that they are well connected.
Yeah, I think it's important for people to hear, because we're all measuring everything. We know how important it is in terms of our management, but I've certainly seen it in the companies that we've been involved with. And I think it's important for people to hear it because it's part of our mission, but also it has a tangible transfer into us doing better by doing good. You mentioned a few minutes ago all the other issues that have come forth by the pandemic, and a big one has been the bright light that has been shown and laid bare the egregious disparities of healthcare delivery, the inequities in our health access and care. We've all felt them and known about them, but there's no question that the pandemic has just put this light on them. And a lot of that is being disproportionately borne by people of color. And I read that you did launch a huge initiative to address racial injustice. It's been such a big issue at the same time of pandemic and not tied to it directly, but tell us a little bit more about that.
Yeah, let me start by saying that we're not brand new to this, right? So over the last 5 years, we probably spent about $10 million in this space. But what we did was, with all of the attention on this spot and us taking another fresh look, we said, we're going to make a $25 million commitment over the next 5 years. One of the critical pieces to this is not saying, hey, we're going to fund this and we've got all the answers, but it really is a dialogue, right? So we've created what we call the Equity Alliance. It's us working with community partners to come up with answers. We want to make sure that what we're doing is relevant to the community we're trying to work with and trying to solve problems with. We also intensely believe that healthcare is micro-local. You got to be serving communities with what matters to them. Miami communities are not the same as Jacksonville or Orlando or the Panhandle. These are dramatically different communities. That's why I have market presidents in each one of those areas. We break down our communities in smaller than county divisions to understand what's happening in that local community and how do we best serve the people in that community. So it's very tailored. It is very much in partnership, and it varies by each of those communities what we're primarily focused on.
It really goes back to listening to your community, listening to your stakeholders, and it's always a challenge, I think, for big companies. And I know a lot of people listening to us are innovators, are creative people, are entrepreneurs, are leaders of small and mid-size and large companies. But I think that consistent message which you're giving us, even in an organization, a holding company as large as yours, it's all local and it's all listening and it's all empathy and all culture.
Yeah, Bill, I would give you one other element of it. We've been committed right along to our organization must reflect the community that we serve. And so throughout our ranks, we want to look like the community that we're taking care of. So, you know, we have 4 market presidents. The 2 of them are African-American males. One's a female who runs our Miami operation, and we have 1 white male in one of those roles. So we're very diverse in how we come to the community, and it doesn't start right there. It starts with my board. So I have a small board with 11 outside directors. 75% of my board is female or minority. I don't think you can find that across most of corporate America. And so we really are reflecting back the community that we're serving throughout our organization, and we're committed to doing even a better job of that as we go forward.
Pat, again, it's so frustrating because we got limited time and there are so many issues to talk about, but one that we're right in the middle of, and that is the Supreme Court now considering whether the Obamacare, the Affordable Care Act law should be struck down. And we've all been so occupied with the elections and following them and looking at the outcomes and the like. A lot of people haven't been thinking a lot about it, but it's a big deal. How are you addressing that? Are you preparing for the possibility that the exchanges could be in some way invalidated, or do you just sit back and you wait and see what happens and then have the flexibility and the nimbleness to adjust?
Well, we're doing a little bit of both. Certainly, I happen to believe that the court is not going to strike it down. I think severability will carry the day, but we have to plan for the eventuality that it could be struck down. So we're planning on both levels. But I'll tell you an interesting piece to this, Bill. 2 things. One, last week I was at the University of Miami running a panel, and I had the American Hospital Association, American Medical, AHIP, Group Medical Association, virtually everyone, American Nursing, every major stakeholder in healthcare on this one panel. And I asked each of them, do you enhance the ACA or do we repeal and replace? All of healthcare believes you enhance the ACA. The people who know think the ACA needs to be continued. In Florida, we're an interesting case study for the ACA. We have 67 counties. We've been in all of them from the beginning. But right now, 64 of those counties have competition. It used to be 40 of the counties didn't. Now we have competition everywhere. Most of our counties, it's 3, 4, or 5. In our urban counties, we have 7 and 8 plans fighting it out. The rate increases have been nominal the last couple of years because the competition is intense. That's what the ACA was supposed to do. So if you build on that structure and you add a couple of things like enhanced payments for younger people to be in the pool, so you age adjust some of the incentives and you do a reinsurance over the top, we think we can take premiums down 25%. That should be a bipartisan issue. If you can reduce premiums 25%, we ought to be making those enhancements. It shouldn't be about red and blue. It should be about an American answer. We've put all the infrastructure in. Let's make the enhancements that allow the ACA to work better than it's been working, because the big issue in the ACA is affordability. It's not affordability for those who are subsidized. It's affordability for those who aren't subsidized. We can make it affordable for all people if we make a couple of changes to it. So ripping it out at its roots makes no sense to me at this point.
Well, it is interesting. And I think this most recent election was the first in a long time that Obamacare, the Affordable Care Act, hadn't been at the top of the list, at least of the Republican Party, in terms of wanting to take it down, and the Democratic Party of wanting to preserve and modify and improve. And the fact that it wasn't sort of a top issue, I think gives at least me a great hope that in this new environment, we have to get through the Supreme Court, that we will be able to appropriately modernize and change what needs to be changed to make it really improved, and whether it's access or cost or quality coming across. So I'm pretty hopeful there. Let me ask again a few remaining minutes, and my last question could be to look into the crystal ball. But before that, going to the personal side, and I keep coming back to the personal side because of your long history of success. And I know whenever you're that successful, you have a lot of failures along the way. You just want to hide those. But I don't want to hear about them. But was there a moment in your career that you can share with us that was sort of a pivotal moment? You've had this visionary approach to health and well-being and healthcare over your life, but was there ever a pivotal moment that meaningfully changed your outlook or influenced your career trajectory?
Bill, I think the biggest change for me was I started in the sales and marketing side of business. And it was very important for me to know the product inside and out, understand how it all came together. And I was 10 years into a sales and marketing career, earning the commission and feeling pretty good about life. And I had an opportunity to make a lateral change over to healthcare management with a glamorous offer of you will be able to negotiate capitations with physicians and global deals with hospitals in the evening, and you'll have to give up your commission. And I was crazy enough to say, that sounds wonderful. And I did this lateral move over, took a drop in compensation, and learned at the grassroots level of what it meant to be talking about value-based care in the first iterations of value-based care, and sit with doctors and sit with hospitals and really do that at the grassroots level and understand and learn the business. And what it opened up for me, whether I meant it or not, it opened up for me is not being single threaded, because then the organization next gave me an opportunity to run the pharmacy part of the business. And then I ran operations. And so it gave me this chance to learn, to dive into subjects I hadn't previously been the expert. And really, it was an opportunity to take my career and spread it out more comprehensively. And I think that opened the door to being a CEO. And it was risk taking at the time. And I had others who were saying to me, "You're crazy to do this." But I think it was the path that made everything else possible.
But it's so useful for people to hear, because whether it's lateral moves or whether it's not quite being the position they had envisioned, sometimes opens the biggest doors, as you've said. And again, among people listening like myself, that sort of counseling and advice and anecdotal narrative is really important to recognize as we go forward. Well, again, we're out of time, but we've got 2 or 3 minutes. So let's look into your crystal ball. We've talked about the pandemic. We've mentioned initiatives around racial injustice. We've had today in the broader macro sense, this move to, you mentioned telemedicine, teledoc, this move to virtual care. We have artificial intelligence. As you look into that crystal ball, and clearly you can be eating broken glass at next year's meeting, but what do you think in terms of healthcare transformation over the next, say, 3 or 5 years?
Well, I think there are a lot of topics in there, Bill, but certainly mental health and the integration of mental and physical health. I think the time has come on that one. People have been talking about it for a long time. We just bought majority ownership of New Directions. So we now own the largest share of a mental health company, with the intention of driving physical and mental health integration in a much more connected way. Just recently, Livongo and Teladoc announced their merger. And when they announced it, they announced their first merged customer as Guidewell Florida Blue. And that's because we see them as leading edge, and we want to be partnered in that arrangement. Online capabilities are going to be absolutely critical. So the ability to bring that digital into play, to be in the home. We have Pop Health, which is right there in Nashville, Tennessee. We also have another Nashville, Tennessee company in OnLife. And so we see the platform of OnLife with Pop Health, with our Teladoc Livongo combination as that digital, bring it into the home space, come to the member, come to the customer where they are, bring health around the member is the revolution that happens. And we're trying to drive that and make that happen in a more effective way and as fast as it possibly can. And that's where we see the future heading.
Pat Geraghty, CEO of GuideWell and head of Florida Blue. Thank you so much. You know, I would say I want your job because it is so exciting. The things you say, the reach you have, the breadth you have, the knowledge you have. And truth, I wouldn't want it at all because there's nobody that can fill the shoes that you filled today. But thank you so much for being with us. Appreciate it.
Very, very kind of you to say, Bill, and I always appreciate working with you and your insights. So thank you.
Thank you.